Hello, friends. Today I'm going to talk on anesthesia, complete specialty. This is my favorite subject. I've given talk on this subject for the first time in the year 2008 as a keynote address in Maharashtra State Conference of Indian Society of Anesthesiologists held at Akola in the year 2008. And thereafter, I have given this particular talk at various anesthesia meetings, various medical specialty meetings, and even in lay people meeting. Today, I want to relive the moments, and that is why I am presenting this particular talk. This is a picture of Prabhu Sri Ram at the time of Sita Swayamvar. The Shivadhanusha, which great warriors like Ravan were unable to even lift, and this teenager broke that Shivadhanush. How he could do it, and why only he could do it? Because he was a complete man. And so is my specialty, anesthesia. It is a complete specialty. Now let me tell you what exactly is a complete science. A complete science is where you know each and everything, every minute thing about that particular thing. For example, in physics, we tell that water boils at 100 degrees centigrade in under 1 atmospheric pressure. This is true everywhere. In mathematics, 2 plus 2 is always 4. It cannot be 3.95 or 4.05, nothing like that. 2 plus 2 is always 4. But in medicine, does that happen? No, it doesn't happen. Every time you treat a patient with particular disease or particular symptoms, for one patient you get the result, for another you may not get the results. Because this medicine doesn't work like mathematics. So it is not a complete science. But the specialty can be complete. Then why I am saying anesthesia is a complete specialty? Because you see, there are specialists of eye, there are specialists of ear, nose, throat, there are specialists of bones, there are specialists of only medicine, specialists of only surgery. But anesthesia is a specialty where we study patient as a whole. We manage all systems of body. We care for all parts of body. Even the social and psychological aspects are also taken care by us. We are offered the responsibility of pre-anesthesia period, intraoperative management of the patient, and the post-operative management also. If we compare other specialties, I think only general practice can come near to us. But unfortunately, it is not called as a specialty. So the only specialty, which is a complete specialty, is anesthesia. And anesthesia is different from all other specialties. How it is different? First and foremost important thing is we get immediate effects. For fever, you have to give drugs, paracetamol, and wait for the response. But in anesthesia, we get response within minutes, sometimes even in seconds. So this is also dangerous. So we need to have a prompt action. The anesthesiologist has to be very prompt in action. Then another thing is our results are predictable. Again, let me take example of paracetamol on fever. For few patients, you give paracetamol, you get result immediately. But in another patient, you may not get that result. So the things are not predictable in other specialty, but in our specialty, we are almost near 100% predictability. And because of all these things, naturally, the expectation of people are high about us. They think that we got to do miracle, we got to do miracle. There is no alternative. So our miracles are not considered as miracles, they are considered as routine thing. And that's why there are so many, there are high expectation from our specialty. But in spite of that, we have got very minimal recognition amongst the lay people. We are as good as the backstage performer, and we only come, the curtain raises only after complication. If there is any problem, the anesthesiologist is presented to the crowd. Unfortunately, these are the things. I want to tell everything about anesthesia to you. Let us start with history. The history, people believe history only when it is written in black and white. So let us go to the most popular book in English literature, Bible is Bible. So the history written in black and white. You know, Adam was sent to earth by God. He was the only human being on earth. So he got bored because of the loneliness. He asked God to send somebody. And then God decided to send Eve. So Eve was born from the ribs of Adam. So we think that probably this is the first medical event on the earth, because there is no history written that Adam fell ill and he got some treatment or something like that. It's not written. So what is written is Eve was born from the Adam of rib. So this looks to be a first medical event on the earth. But wait. Before that, God made Adam sleep. So naturally, the first medical event is God giving anesthesia to Adam. So the first medical event is, of course, anesthesia, and God was the first anesthesiologist, which is recorded in black and white. This is a picture of modern and birth of modern anesthesia. On 18th October 1846, Dr. William Thomas Green Morton demonstrated that patient can be anesthetized with vapors of ether. So this day, 16th October, is considered as Anesthesia Day, birth of a modern anesthesia, and the world celebrates it as an Anesthesia Day. Now let us see what are the avenues of anesthesia. How much work the anesthesiologist can do. Anesthesiologist prepares the patient for surgery and anesthesia. He manages the patient intraoperatively, and he also helps in management of postoperative management of the patient for pain relief or any other thing which he needs. In addition to that, these first three things, I think everybody knows it. But these are the things which many people may not be knowing, especially the lay people. Anesthesiologists are very good for neonatal resuscitation. They are expert in intractable pain relief. They can offer painless labor to the patient, needy patients. They are very good in intensive care unit, and they are the best for disaster management. And in addition to that, they do teach cardiopulmonary resuscitation to anybody who wants to learn. Now let us see what this neonatal resuscitation is. This is a picture of Vasudev saving Krishna from the storm and the curse of Kans. Presently, what you see is baby at birth sometimes need resuscitation. Many times baby is not taking proper respiration at that time. Baby is blue. And at that time, the anesthesiologist can resuscitate the baby and kind of put life in that baby. Nowadays, only at the time of cesarean section, anesthesiologists are helping to do this thing, because there are new specialists neonatologists who are coming in the picture, and they can manage the patient baby right from the birth. So this work of anesthesiologists is nowadays reducing, and in few years to go, probably anesthesiologists will not be doing this particular job. Is being taken over by the neonatologist. Anyway, it happens. Then intractable pain relief. What is that? Intractable pain relief is where everybody else fails to give pain relief, the anesthesiologist is summoned. This is a picture of Bhishma Pitama lying on Sharpanjar, and he wanted water at that time. So Arjun here brought the water from Patal. This kind of job the anesthesiologist has to do, where anybody else cannot do it, the anesthesiologist enters to relieve the pain. Pain that can't be relieved by routine drugs and methods are termed as intractable. Mainly, these are happening in cancer patients, in many of the terminal illnesses. Presently, what is happening is only the affording class of the patient is benefited with this particular technique, because the poor cannot afford it. This requires specific drugs, specific treatments. So the teaching institutes need to stress more on this, so that the poor people can avail this facility and get relieved from the pain. Now, painless labor, what it is. See, birth of a child is very joyful moment in the family, but unfortunately the mother has to suffer pain, severe pain is there. And somehow people think that that pain is inevitable. The mother has to bear the pain so that the child will be better. Even in last century, in 19th century, people used to kind of oppose the idea of pain relief during labor. This is a picture of Jon Snow and Queen Victoria. Queen Victoria is the person who gave permission to Jon Snow to offer her vapors of chloroform for pain relief. And this gave some recognition to painless labor in the society. Presently, what is important is we need to keep the mother's cooperation intact with the pain relief. We cannot afford to make the mother unconscious at that time, because for pushing the child out, mother's cooperation is very much indicated, very much required. This again is presently offered only to the affording class, because poor patients still may not afford this particular branch of anesthesiology. There is some resistance from other medical specialists like obstetrician also, because they think that instrumental delivery increases after painless labor. But the recent techniques, the newer modalities, this particular thing is not there. Patient's cooperation is very much there, and instrumental delivery is not at all increased because of this particular thing. So there is a need of more awareness amongst obstetricians and lay people to have this particular thing going, because it is mother's right to have pain relief during childbirth. Now, intensive care. This is a picture of Savitri urging Yama to give back her husband's Satyavan's life. Anesthesiologist fights with Yam to save his patient's life. The special training of anesthesiologists in managing the unconscious patients make them expert in intensive care. Presently, many anesthesiologists are opting for this particular job. And of course, this is very demanding work, but at the same time, it is more lucrative. And we do get more respect in the community. As an anesthesiologist, people do not know who he is, but intensivists, definitely people respect too much. So this is a good branch of anesthesiology. Disaster management, again, we are very much useful. This is a picture of, again, a story from Bible, where the prophet Noah saved earth, saved the mankind from disaster in those era. Because of the special training in managing unconscious patient and emergency situation, make the anesthesiologist expert in managing any disorder, any disaster with medical emergencies. Unfortunately, still there is less respect for anesthesiologists in this field. Intensivists are definitely more respected, and many times the leaders are from surgical specialty, maybe general surgery or orthopedics. But if you give this responsibility to anesthesiology, the results are definitely going to be better. So there is a need of government machinery to recognize anesthesiologist as a team leader for disaster management. Teaching CPR, cardiopulmonary resuscitation. This is a picture of Prabhu Ram and Bharat. Bharat ran the Ayodhya kingdom from taking advice from Prabhu Ram. So the layperson can learn cardiopulmonary resuscitation. Suppose you are walking on a road and somebody feels unconscious. Then look for the pulse and try to resuscitate him, try to help him. And how you can help? With the help of cardiopulmonary resuscitation, or presently what is called as compressions only life support, COLS. This you can definitely learn from anesthesiologist. This is definitely best taught by anesthesiologists to the lay people, because this is our day in and day out duty. Indian Society of Anesthesiologists, national branch, state branch, they promote this activity. Few city branches like Kolhapur Society of Anesthesiologists, they are working seriously. Because of our work, we could save so many patients, and the results are definitely good and encouraging. And this again, this is a good asset to improve our image amongst lay people. Preoperative preparation. This is our main job. Preoperative preparation, intraoperative management, and postoperative management. So this is a picture of Arjun and this is a picture of Arjun before the war of Mahabharata. He went and did tapasya, and then Shankar offered him the Gandiv Dhanushya and Brahmastra. So before going in for war, before going in for surgery, we prepare the patient for best results. So this is the duty of everybody to prepare beforehand only. Before surgery and anesthesia, a patient is to be brought in best possible condition of health to bear the trauma of surgery and anesthesia. Now, when you can say the patient is fit? The patient is said to be fit when the benefits offered by the procedure, by surgery or anesthesia, outweigh the risk involved because of anesthesia. When the benefits are better, you can go in. If the risks are more, better to avoid the surgery, better to avoid the procedure. And why we are worried is there are so many drug interactions. There are so many drugs we are giving, the antibiotics are being given, the anesthesia drugs are giving. So we must manage the interactions if at all there. Then this fitness doesn't depend on only the patient's medical condition. Of course, the most important point is patient's medical condition. Another important point is the surgical technique. And what is more important is the condition of operation theater. Then what equipments are and what drugs are available for the anesthesiologist. So all these things contribute towards the fitness of the patient. You just cannot give a fitness certificate without knowing what the procedure is, what are the risks involved. Nowadays, there are many patients coming to us with a fitness certificate from a physician, from a MD medicine person. But actually, that person doesn't know what is the risk of operative procedure, what are the risks involved with the anesthesia drug, and what are the equipments available at that time. A person fit in a corporate hospital may not be a fit in a small nursing home operation theater. So that thing only the anesthesiologist can decide whether the patient will be able to tolerate the procedure or not. And how we manage the patient intraoperatively. See, look at this picture. This is a picture of again Arjun at the time of Draupadi Sanyoga. So he is aiming at the eye of the fish, and the fish is rotating. And Arjun is aiming by looking at the image of the fish in the pond, in the water. So that kind of job we are doing. We are managing the patient by looking at the monitors, and the monitor is showing what is happening in the body. So this is the most indirect evidence that how we manage is the management depends on the medical condition of the patients, the equipment available at our disposal, and surgical procedure, what surgical procedure is going on, because those have much more impact on the body of the patient. So monitoring is definitely very important, although indirect evidence, but we do get some information what is happening in the patient's body. We are having less helping hands. Many times we work alone, and the working pattern changes in every operation theater. And because of the Consumer Protection Act, there are so many restrictions on us. We have to write each and everything. So we have to concentrate on the monitors. We have to concentrate on patient's body. We have to concentrate on the what is happening in the surgical procedure. And at the same time, we have to write notes of everything at that time. Now, this is increasing burden to the anesthesiologist, but anyway, it is okay. It is part of our job. We are doing it. What exactly we do is, suppose the surgery is going on and there is a lot of bleeding. See here, Dushasan is pulling the robes of Draupadi, and Bhagwan Sri Krishna is providing. So here the bleeding patient is saved because of blood transfusion offered by the anesthesiologist. This is interesting. This is a picture of Rajputra Uttar and Brahannada. Kaurav attacked the Rajdhani of Uttar, and that time nobody else was there. So Rajputra Uttar went for the war. But looking at the huge population of the opponents, Kaurav, this fellow lost his courage. And that at that time, his chariot was being driven by Brahannada. Brahannada was the Arjun in disguise. And at that moment, when Uttar was totally depressed, Arjun came out of his disguise and took over the charge. So during surgery, if everything is going on smoothly, the surgeon is in charge. Surgeon is in charge of that situation. But suppose something happens, there is some kind of emergency, then the anesthesiologist takes over as the captain of the ship, captain of the operation theater. Now, what is post-operative management? Post-operative management is patient is shifted to the ward, then patient needs pain relief, or if anything, any other problem like management of blood pressure or something like that. What is presently happening is these are managed by surgeons, and they consult physicians if there is any medical problem, and only pain management is offered by anesthesiologist. But what is happening is mainly anesthesiologists are not there. They are offering this pain management on phone. So the picture which I showed you was a picture of Raja Dashrath aiming at the deer who was drinking water. Raja Dashrath heard only that some animal is drinking water, but actually that sound was from Shravana bringing water from the river. And so what is happening is anesthesiologist giving orders or giving suggestions on telephone. This is like, and you know what happened to Dashrath and Shravan. So my advice to anesthesiologist will be to look after post-operative care very more seriously, not like Raja Dashrath. Let me tell you something about the medical hierarchy. See, this particular poem I wrote quite few years back. Who says there is no hierarchy with us? We are born with it. The medical field only won't be aloof from it. The physicians are like Brahmins. All decisions, including when to operate, are theirs. Who are the Kshatriyas? It is obvious, winning the medical world on the edge of knife. The general practitioners are like Vaishyas. The economic cords are always in their hands. Now the remaining ones, radiologist, pathologist. Well, they are like OBC. Nowadays, they are booming with interventional radiology. Then because of CPA, the work of pathologists has increased. And the poor anesthesiologist. Oh God, even no reservations for them. Presently, the situations are changing. The truth is becoming opposite now. Look, everybody is dependent on somebody. We are dependent on surgeons. The surgeons are dependent on general practitioners because the general practitioner only can send patient to them. So these kind of things are happening. But what is more important is only anesthesia gives maximum predictable results compared to any other branch of modern medicine. The surgical results are immediate, but there is too much morbidity is there. With anesthesia, morbidity is less, but there is always a death risk also. And our immediate results are definitely good. There are a few advantages of being anesthesiologist also. There is no chance of malpraxis. If there is no pain, there is going to be no anesthesia. You cannot have a unindicated anesthesia in the world. There has to be pain, then and then only we offer anesthesia. For anesthesiologists, we need very less investment because main investment has to be made by the hospital, and we visit the hospital only on invitation only. So naturally, we don't have any headache of staff management because again, the staff is of hospital only. And most important thing is we deal with qualified people, with surgeons, physicians, we deal with qualified people. So naturally, they know our limitations. They know what is the best technique. They know how, why the complication has happened. They won't blame without knowing the facts because they know the facts. The good quality is definitely applauded, and people help us whenever these qualified people can help us if we land in some problem. So from that point of view, we are definitely better placed. Then this is again a drawback of anesthesia practice is we are being least paid specialist among the medical fraternity. Why this is happening is because again people say that our investment is less, people doesn't know us much, and again we are not generating work directly. If there is no pain, there is no role of anesthesiologist. So there has to be pain. The surgeon offers pain, we offer anesthesia for that. In spite of being so, advantages, disadvantages are still there. Still the specialty is most vulnerable for criticism. You know, even Sita, in spite of being the obviously the greatest Pativrata in mythology, she has to undergo this Agni Divya to prove herself. The anesthesiologists are having so many health risks also. There are chances of mental depression. It has been proved that suicidal tendencies are more amongst anesthesiologists. Even the drug abuse are seen in the population of anesthesiologists. There are said to be increased risk of abortion in female anesthesiologists. And again, it is being claimed that there are increased chances of female babies for male anesthesiologists. There is some risk for liver of anesthesiologist also because of the drugs used for anesthesia. The vapors are inhaled by anesthesiologist also, and the constant exposure to the vapors make the liver vulnerable for damage. This is a picture of Bhagwan Sri Krishna and Arjun going for the war. यदि ऑपरेशन थिएटर रंगभूमि है, यदि यहाँ का योद्धा अर्जुन सर्जन है, तो रणभूमि पर ले जाने वाला, सही राह दिखाने वाला, विपत्ति के समय का एकमेव साथी, सखा, सारथी श्री कृष्ण anesthetist है. Thank you, ladies and gentlemen. Thank you very much. And please remember, anesthesia, a complete specialty. And we are the lifeline for the patient. Thank you.